Welcome everyone to the RPH Ally Peer Support Show. My name is Eric Speck. I'm the RPH Ally Peer Support Director. And today we have a very, very special guest. And I know I say that often, but this time he is truly especially special. And we're going to dive right into his story, what he wants to tell us right after this reel. Awesome. Fred, thank you so much for joining us today.
My pleasure.
I want to give the viewers a little bit of our history. So I met Fred about 10 years ago when I was first introduced to recovery and started working a 12-step program. You know, when I was going through my stuff, I thought I was the only pharmacist who ever had issues like the ones I was going through. And going through my local meetings, I was told that no, there's another pharmacist. His name's Fred. You've got to talk to Fred. You don't know Fred? And I'm like, no way, there's more than one of us. You know, I got to meet this guy. And I was so glad I was introduced to you. And you weren't my first sponsor, but I immediately asked you to be my sponsor after getting to know you a little bit better and worked with you for a little while. But thank you for joining us, Fred. I know I asked you if you wanted to join the show, what you want to talk about. And you said you'd like to tell, pharmacists or anybody else doing this, what options may be available if they're struggling with a substance use disorder, because you felt that many pharmacists and other professionals may not know what options are available to them.
Yeah, that's true. I think as a practicing pharmacist, I had no idea of the potential help that was out there for someone that was suffering with substance abuse disorder. So my initial thought was pretty much my life was over, and I would need to go drive a truck or do something else for my career.
Yep.
And you would think, as a health professional, as a doctor of pharmacology, that I would know what options I had at that point.
Yeah.
And, I didn't,
And are you talking about options just for pharmacists or options for anybody out there? Does it matter? Is there a difference?
Anybody out there. Obviously, as a pharmacist, I thought I was special, and that is true. That was a nice introduction, by the way. But just for drug addiction in general, I had no idea of what could possibly happen. And so that was why one of the first topics that came to my mind was, we need to let people know that may be suffering, that there is indeed help out there. And it depends on where you live as far as the quantity and quality of that help. For pharmacy in general, I'm in California. The state of California offers no help whatsoever. We have a attorney general that will put you in jail. That's what we have for help. And there's very few states that fall into that category. A lot of states have what are known as PRNs, or pharmacist recovery networks. And that's a whole nother topic for the show. But
that's like last week we had Nancy on with a Tennessee PRN. And my big question was, why doesn't every state be like Tennessee? It just makes total sense for the pharmacist, for the board, for everyone involved. And it's probably a lot more complicated than I realized, but it's a no-brainer to me. But obviously, there's a lot more into that. So, Fred,
it's a complex issue for boards, because the purpose of pharmacy boards are to keep the public safe. We want to keep the public safe. And a pharmacist who's using, narcotics, for example, that may not be the safest thing for the general public. So, how to handle that varies from state to state. And what I found out, though, in my own personal case, was that there is indeed hope. Your life is not over. And I went into my recovery not as a pharmacist, just as an addict, just as a using addict that couldn't stop using. And
did you go into treatment kicking and screaming, or did you go with readily accepting everything that was being offered and thrown at you?
I don't know. I think primarily I went in hopes of saving my job. That was my first, so I could maybe still be a pharmacist, because I had done a few illegal things. So I was facing a little bit of legal consequence because of that. And I had an attorney at the time, and I had just lost my job, and my wife had recommended rehab. And I was like, what is that?
Yeah.
And so we got out the Yellow Pages, which is a book that used to have phone numbers for those that are younger than me.
Yeah. But, and remind us, how long ago was it that you went through this? You don't have to. You're gonna have to date yourself a little bit here.
Yeah, this was about 29 years ago. So
about 29, somewhere around there, 29 years ago.
Yeah.
What I'm interested in, we've come a long way in 29 years as far as stigma and treatment for substance use disorder. And I know 29 years ago, you weren't aware of what options were out there. Do you feel that now in 2023 we made enough progress where there's going to be a much greater awareness of what options are available? I mean, obviously not. You want to talk about it today.
Yeah, I don't think so. I mean, it's certainly better depending on who you're talking to. But for example, California still has no program. So that's 30 years of nothing happening here. And in that 30 years, addiction became identified as a true disease, right? It's in the, what's the word I'm looking for? DMSO4 or whatever.
DSM.
DSM4. So, and that wasn't the case 29 years ago. So, I mean, there are probably more rehabs now. There's more places to go for help. There's more detoxes, through all of that stuff. In my personal case, I needed to go to a 28-day rehab just to find out about addiction and recovery. And you would think, as a pharmacist, I would be well versed in both of those areas, but really not so much. And even today, I don't think a lot of pharmacy schools have a lot of curriculum devoted to that. So,
I think so.
Yeah, and so I found that I was introduced to the 12-step program of Narcotics Anonymous. I found my first sponsor in rehab. He was introduced to me much like I was to you, in that I thought I was the only pharmacist that had ever done anything like this, and it was just horrible what I had, done. And they introduced me to this man, Steven, who had 6 years clean in Alcoholics Anonymous. And so I was like, oh my God, there's two of us, right? I mean, an entire planet. And I've come to find out that that's not true. But I mean, it's important that people know that it's not a moral failing. It's not something that you could have prevented maybe by doing something differently. It is what it is, and there is hope out there. There's help. You can recover from the disease of addiction on a daily basis without question.
Sure. And let's go into your story just a little bit. So 29 years ago, you're working as a pharmacist. You developed a substance use disorder. And I don't know how much detail you want to go into, but what I was going to say next is you were essentially forced to enter treatment. And like you said you thought your life was over, your career was over, you could never practice pharmacy again. You realized that wasn't true. So you went to it sounds like a 28-day program. You got really involved in a 12-step program. And then you kept working as a pharmacist. You were able to keep your pharmacist license, go through all the appropriate steps or hoops that you had to go through. And then you worked for another almost 30 years, right?
Yeah. I just recently retired. So in my particular case, I didn't have any board involvement. For whatever reason, I slipped through the cracks of the legal system, which is fine. Over the course of 3 decades, though, I've met many, many pharmacists that had to deal with the rough road of their state's board or their state's legal system or whatever it happens to be. But I mean, for me personally, I found that the 12 steps allowed me not to use any chemicals on a daily basis, which I found almost impossible to do on my own. So I think before I lost my job and was arrested, I think years before that, if you'd asked me, I probably would have admitted to being an addict, but I didn't really care. I wasn't about to stop or do anything. So I didn't have enough consequences to push me over the edge yet.
Yeah. And after you went through treatment, have you stayed 100% clean and sober since then?
I have, yes.
Weekends too, huh?
Every weekend, yeah. Holidays, weekends, yeah.
That's just a joke for everybody who's watching. Cool. And the 12-step program, how many 12-step meetings have you gone to in your life?
Oh my goodness. I guess we could do the math, but
thousands, hundreds?
I'm going to go thousands at this point.
I'd say thousands. And with the 12 steps, here's a question a lot of viewers may find interesting. How many times have you worked the 12 steps?
That's an interesting question for someone in recovery, because you will find answers from, well, I'm not quite done with them yet, to hundreds of times.
Yeah.
In the middle there, I want to say conservatively 5 or 6 times all the way through, significantly. So yeah, I'm a believer in.
Yeah, I know a lot of people aren't familiar with the 12-step program. They hear the 12 steps. I think once you go finish step 12, you're cured and you're done with the process and you've graduated or something. But I asked that question so the viewers learn that no, when you're in a 12-step program, you work the 12 steps, and when you're done with step 12, you work on step 1 again. Of course, you're going to be at a different place in your recovery, different place in your life, so it's always going to be different. Yeah, you can take a break, but you're always supposed to be working the steps.
Yeah, and people, you'll hear it in the rooms of recovery that every time you work the steps, it's like peeling a layer off of an onion, right? Yeah. There's so many layers, and when you first do it the first time, that's totally different from the time you do it 5 years later.
Yeah, you're always learning something new and learning something new about yourself.
Yeah, but if there's anyone out there that's needs support or doesn't know where to turn or who to call, we're out, we're there. You can find a local meeting in either AA or NA or any of the other anonymous meetings. There's wonderful programs like Eric's running and things like that you can look to for help. You could look on the internet to find help. I mean, the resources are literally everywhere, and you can make it.
Yeah, I think the most important thing, as Nancy talked about last week, was early intervention. If you think you said this, Fred, if you think you have a problem, you do, right?
Yeah.
If you think I remember you told me that 10 years ago, I'll never forget that. Is this true? Reach out, start asking questions. People know where to find me, rphally.com. I'm all over the place there. So if you have any questions, you want to learn more, reach out to me on there privately if you want, or you could post on the main page, if you want to ask the question publicly and get a response from a lot of members, whatever you're comfortable with. But definitely you don't need to suffer another day. Some people think there's no other option and that they're stuck in this addiction, whether it's minor or it's severe. They don't think they have any choices, but you do have choices. You do have options.
And I would like to add to don't be afraid to talk to a coworker. Maybe you're fine and you have a coworker that you have doubts about or something. Yeah. It's perfectly okay to take them aside and have a discussion. Don't let that stigma stop you from helping somebody.
Yeah. So definitely, we talked about 12-step meetings. We've talked about, inpatient treatment centers. And then what about having these conversations with your physician or with your counselor, your psychologist? Is this something you should be completely honest with them about and see what treatment options they may suggest as well?
Yeah, certainly it's another option. I would just, as a cautionary note, much like I was surprised at how little I knew about addiction and recovery, I would not be surprised if your personal physician falls in that same category.
Very true. Last thing I want to talk about, I know you're a big fan of the APH Institute on Substance Use Disorders. We had a show about that the other week after I came back and talked about how great that event is. And you've been going there for 20 something years now.
Yes.
You're still going as a retired pharmacist.
Yes.
Tell the viewers, what do you like so much about that event? And would you recommend that they go?
I certainly would. It's a 5-day school put on by the American Pharmacy Association. They invite students from every pharmacy school across the nation. So it's usually 200, 300 students. And the focus is obviously education about addiction and substance abuse disorder. And, they're getting the word out to the people that need to hear it at an early stage in their education. And people like myself go, and there's quite a few that have been there for many years that keep going. And I think I go primarily just to support it physically, just so people can look at me and go, oh, it works,
That's awesome. And people like me appreciate people like you. Keep on showing up.
Yes, indeed.
Okay, cool. All right. Well, I think we're going to go ahead and wrap it up here. Thanks to everybody for watching today. If you have any questions, need any help, you know where to find me, rphli.com. If anybody liked Fred so much and you want to get in contact with him, reach out to me and we'll see if we can set something up for him to answer your questions. He was a great help and support system for me back in my early recovery and continues to be support for me today. And I'm probably going to start bugging him a little bit more than I've been in the last couple of years just because he is such a great person. Fred, thanks again for joining us, and I'll be talking with you soon.
It was my pleasure. Be well.
All right. See you.